if it sends it to you. All right. I think we may have it figured out unless Devin cannot join. So did you get the invite? Because it says
you. I'm here.
You're there. Where does it, what do you see?
I see you live.
You see me. I don't see you. How? See, oh my God, we're fired from all of this. Like, I can't hear me talking either. I don't know why I can't hear me talking either. What is?
I hear you through my phone and through the live.
See, it tells me I need some tech savvy person to come over here and educate me on why I can't hear anything other than Devin on the phone. And she can see me, but y'all can't see her. This is just nuts. Nuts, nuts, nuts. And it said I could share, screen share, but
I don't know how to ask to join. It doesn't show me.
well, I guess we figured out how to add you, but now, now we don't know how to have you show up on there. Let's see. I'm trying to see if I'm just going to click on stuff. We're just going to see it. I don't know. If anything, they could just sit there and watch us, you know, just talk about stuff that doesn't matter.
Is there anything that says send request?
No, what is this? Event logs. Doesn't say, there's no send request anywhere. It says one viewer, which I assume is you.
Yeah, can you click the, like where you see the viewers, where it shows you the viewers list?
Let's see. I keep getting these weird little pop-ups about something. It just shows one viewer, and it doesn't show where I can click on you. So I guess we figured that part out, how we can add you. But now I have no idea. Oh my God, how to see you on here. And I don't know if anybody can hear you talking, because if they can, we'll just leave you on the phone instead. So I guess I need, okay, so now it says there's 2 viewers. So someone else is in here, and I wish I could see who it was. And I don't know how to make that happen, but whoever is viewing right now, the other one besides Devin, if you were on there, tell me if you can hear Devin on the comments. You got a comment. Tell me if you can hear Devin talking through my cell phone. And then maybe we'll just do that.
I'm here on the phone.
You're here on the phone. Well, now we don't have the viewer anymore. They left. They're gone.
Oh.
It's just you and I, friend. No one wants to talk to us.
Well, I'm in the event settings trying to see if I can make, like, you know.
How you can share my screen and put you on there. Like it says screen share, but I don't even know how you do that. Because that would add you to be able to see what's on my laptop, not. Not what's.
We suck at this.
We do suck at this. This is terrible. This is terrible, awful, no good. No good.
No.
Oh, okay. So my cousin, he just posted, so he can hear both of us talking. Okay, so I guess unfortunately Devin and I are not tech savvy even together. Me alone by myself, I'm terrible, but Devin and I are not tech savvy together. So we're going to have to figure out a way next time to get her on the video where you can see her too on the Facebook Live, because I added her to this Facebook Live as a co-host, and I don't know why I can't get her on there. I don't understand. So if anybody else knows, again, you know, let me know, because we're not good at this game. I guess we're just going to have to meet up every Sunday, Devin, and we're just going to have to hang out and Facebook Live together at, I don't know, coffee shop or something.
We'll drink some mimosas.
Drink some mimosas or some coffee, some Bloody Marys, you know, something. We'll drink something. Because I still don't know how to add you on here, which makes no sense to me. I don't know.
Everything I Googled says you have to click the viewers list.
And I tried, and it won't even let me click a viewer. TikTok might be easier. Yes, we were going to do a TikTok. I was totally planning on doing TikTok lives and having Devin and, you know, my other RVT friends and my vet assistant friends and my veterinary friends and anybody who wanted to be on my TikTok live. But unfortunately, you have to have 1,000 followers to be able to do any TikTok live, which is just absolutely silly. So we're going to try Facebook Live. Maybe I'll just start doing YouTube and then share the link and you can come and watch it from Facebook. I don't know. But yeah, any advice you can give, definitely holler and let me know. Because really, I'm just going to have to Google. Devin, we're just going to have to Google and Google and Google until we figure out what the heck we're doing.
Yeah.
Oh my gosh. Oh my gosh. Well, we have 3 viewers now. So that's better than no viewers, even though they're probably me and you and my cousin and probably one of my kids. That's okay. That's okay. Gotta start somewhere, right?
Yeah.
So you can see me though on your phone, right?
Yes.
Can you see you on your phone? Like, is there a video for you on your phone, or you just see me?
It's just you.
So weird. Because I don't understand. And does it have a chat box where you can chat with people too, Devin? Okay. Okay.
Yeah, it has where I can like comment back, you know.
Okay. Okay.
Yeah, I don't know why it's being real. Yeah.
Well, I guess this will also save to my Facebook page so we can still talk and, you know, say the things for people to know what's going on and what have you. We're presenting with my cowboy medicine, OSU, vet med shirt. I'm not a veterinarian, but we're kind of all in the same in vet med, I guess, aren't we? So the whole point of this Facebook Live was just to see if we could do it, first off, see how many people would actually interact with me, who cares to interact with me, and Devin, and she's supposed to be on my TikTok Live, but, you know, we'll figure that out, or TikTok Live, Facebook Live, we'll figure that out. Anyway, share some education, you know, talk about things that maybe not everybody knows. If you have questions, we'll do our best to answer them. Have a little fun. Show you some of the cool things that I have in my boutique. We'll do that too. And just talk. We'll just talk. We'll just talk. So now we're down to 2 viewers. So I think it's just me and you again. Okay, that's okay. That's okay. So that's okay, Devin. That's okay. So since we are so close to February, which happens to be Pet Dental Health Month or Pet Dental Month, Devin and I figured we'd talk about dental cleanings, oral care for your pets, because it's just as important as it is for you to brush your teeth, as for them to have healthy teeth. Now, not everybody is going to be able to brush their dog's teeth. We understand that. It is a task in and of itself for us to get up and brush our teeth every day and get ready every day. So it's hard to throw that in with brushing your dog's teeth every day. Now, if you could do it every other day, that would be ideal. Even once a week is better than none at all. But sometimes you just can't, and we get that. We understand. So that's why when you bring your pet in for their routine health care, your veterinarian, when he does a physical exam, will recommend a dental cleaning if there's a significant amount of dental tartar on your pet's teeth. And yes, we do have to use anesthesia. They do not sit in the chair and allow us to scale their teeth while they're awake. It's not a thing. It's not a thing. No matter how good you think your dog is, that is not a thing. They do have to be under general anesthesia. Of course, as veterinary professionals, we do take all the precautions that we can to make sure that your pet is safe under anesthesia for whatever procedure he may be going in under, he or she may be going in under. So I really don't know where to go with that. Devin, come on, you're supposed to be.
I'm so sorry. I'm still clicking around trying to figure out how to get in.
So Jason just commented on there. He said, Leo's breath smells so horrible. He won't let us scrub his dentures. Yeah, you can't. Cats are going to be really hard to be able to brush teeth. Dogs will be so much easier to be able to brush teeth. They do have finger brushes that you can use to brush your pet's teeth. You just slip it over the top of your finger. It has little tiny bristles on it. And you can brush your pet's teeth. Now, of course, make sure that if you are brushing your pet's teeth, you are using a veterinary recommended toothpaste, that you're not using your toothpaste, you're not using human toothpaste. That is not what you need to be using to clean your pet's teeth. Use a veterinary recommended toothpaste. You can find them at PetSmart, Petco. You can find them online. Your veterinarian will have them. Anyway, they have finger brushes. You can use a finger brush. That would be an easy way. They also have pet toothbrushes that you can buy that are a little durable, a little more durable than ones that you would just get, you know, at the grocery store, or, you know, whatever your store. You can use also toddler toothbrushes, as long as your dog isn't going to chew it up or, you know, pull the bristles out. You can use toddler toothbrushes to brush their teeth too. But of course, if you can't brush their teeth, that's where going under general anesthesia and having dental cleanings done comes into play. That is something I would say that you would start to do. What do you think, Devin, based on your dog? 5 years of age? Would you think 5 years old is when people should start doing?
Sorry, my big, yes, I would say probably like 5 or 6. That's when we start really seeing them come in with a lot of tartar and populus.
On their teeth, yeah, 5 years. 5 years old, sometimes depending on the dog. I mean, small breed dogs are notorious for having bad teeth because they're not big chewers like large breed dogs are. So they tend to have worse teeth, some of them just by breed. Pomeranians, Yorkies, Shih Tzus, your little toy breed dogs, poodles, miniature poodles or toy poodles, they have bad teeth too. They just tend to have worse teeth. So yeah, usually around 5 years of age is when your veterinarian will start to recommend a dental cleaning, sometimes earlier than that, depending on how much dental calculus is on your pet's teeth. Periodontal disease, if you do not routinely do dentals on your pets, routinely meaning once a year, typically at least. Some have to have them once every 6 months if their teeth are really bad. Can lead to heart disease, just like in people. So if we're not brushing our teeth and we're not keeping our mouths healthy and we have that excess amount of bacteria on our teeth or in our mouths, it can get into our bloodstream. That bacteria can lodge on your heart valves. It can cause issues with your liver. It can cause issues with your kidneys. So overall health, dental health is so important for overall health in your pets. Anything you want to add, Devin? Chime in anytime you want.
No, I have noticed like pets that eat wet food compared to like pets that are eating dry, like crunchy food have worse breath. It's like the ones with the wet food, their breath is pretty kicking.
Yeah, yeah, I could see that.
So
I could see that too.
I would definitely recommend like crunchy like treats for them. Like the greenies treats.
Oh yes. See, I'm kind of all over the place. I don't have a script, guys, so this is totally, I'm winging it. I'm flying by the seat of my pants. So I'm all over the place, and this is how my brain works, and I think about all different things at one time. So I might go off into something else that was completely unrelated to whatever I was just talking about, and I didn't even think about that. Dental chews, dental treats. You can do that as well to help prevent periodontal disease in your pet. Like Devin was saying, the greenies, you can get the greenies, you can get those over the counter. Some of the dental treats are formulated to kind of act like a toothbrush. So as the dog bites on it, it will scrape off, for lack of a better term, some of that plaque on the teeth to help keep the teeth a little more clean. Some of them are enzymatic, where they will help get the buildup off the teeth as well as the dog's saliva interacts with whatever is in the chew or in the treat to help kind of clean the teeth. Nothing's going to top toothbrushing, but the treats is another easy way to not worry about brushing.
Bye, Jason. Bye.
Oh, he's leaving. Bye, Jason. Bye. Actually, did he leave? Oh, yeah, he did leave. Oh, he hasn't got off there yet, so I was going to say, it still says 2
there's
viewers.
one more person in here. Woo!
Oh, no, he's gone. It's just me and you, girl. Just me and you.
I think there's one more. Is it me and you?
I think it's just me and you. Because now it just says 2 viewers. It's just me and you. But that's okay, because this video is going to post for people to watch later anyway on my Facebook page. So, by the way, Devin, I didn't introduce her. I just jumped right in, didn't I? So, Devin is one of my longtime friends. She is also an RVT. And for those of you that don't know what an RVT, an LVT, or CVT is, registered veterinary technician, licensed veterinary technician, or certified veterinary technician. Basically all the same thing, just different states have us named differently. I don't know why. And we basically are your, well, I guess the veterinarian's right-hand man in all things vet med. We can do anything from monitor anesthesia. We're the ones who perform your dental cleanings, your RVTs, so your vet assistants too. So we won't leave them out because there are vet assistants that can perform routine dental cleanings too. So we won't leave them out. But we're the ones that do your dental cleanings. We're the ones you see before the doctor comes into the room. We get the history. We do the TPRs, or we can do mini physical exams. We're your go-between. We're also the ones that handles all the care for your pets, as in any treatments that they may having in hospital. We do that. Medications administered. We do that too. X-rays, yeah, we take those. Fill in your pet's prescriptions. We do that. Answering your questions, answering the phone. Do what?
I said we do it all.
We do it all, yes. I mean, I could probably...
You name it, we do it.
That is true. We could spend a whole hour just talking about all the things we do. So maybe we will do that one day. We will spend one of our episodes talking about all the things we do from like the beginning to the end of our day. We will do that and talk about that. So back to dental health. It is very important. It is very important. Your pet's mental health, your pet's overall dental health, is extremely important in their health care. So, what else should we say? Well, what is periodontal disease? It can be inflammation, basically inflammation of the gums, gingivitis, from all of that plaque and tartar buildup on the teeth causes the gums to get really red and inflamed. Sometimes they can bleed, they can be painful, uncomfortable for your pet. Sometimes your pet won't be or will be reluctant to chew on one side more than the other. It could be because that side of the mouth, for whatever reason, is more inflamed than the other, or they've been chewing on this side because this tooth is painful. It can be tooth root abscesses, gum recession, pulp exposure. All these things can cause pain in your dog's mouth, which is why you need to go in for your annual visits.
Yeah, I was going to say that.
Yeah.
Annual visits, super important, because a lot of times your vet will find a broken tooth that you didn't know about.
Yes.
Or all that dental buildup.
Causing pain, being extremely uncomfortable. I don't know if you guys see my curtain moving back there on the door. My dog keeps peeking at me through the curtain.
Oh, I see it.
She's my special guest. She's going to keep peeking at me through the curtain. What are you doing in there? What are you doing in there? So again, maybe I should just go through the list of what I had, down, because I am all over the place. Let's see. Dental disease can cause systemic disease, which we did, kind of touch on that, which can cause heart disease, cause issues with your kidney, not your kidneys, cause issues with your pet's kidneys, your pet's liver. The bacteria can lodge on the heart valves and cause heart disease. So it is really important to get your pet's teeth cleaned. Let's see. You do need to go and see your vet annually, do a physical exam, which also your annual physical exams, even if it's not just about dental disease and having your pet's teeth cleaned. We have very trained eyes as veterinary professionals, and we can notice things that you might not have noticed at home. We can notice all sorts of things. So it is a good idea just to come in for a routine exam. Every 6 months is what they do recommend to come in for your wellness for your pet. However, at least once a year. And yes, we may pick up things that you didn't see before, but that's our job. That's what we do. We're trained to recognize those things. We're trained to pick up on those things. So don't feel bad if you didn't see it. That's okay. You're not supposed to see it. That's what we're there for. That's what we're there for. So, Devin, before your vet performs the dental cleaning, what are some of the things they typically do prior to your anesthetic procedure?
Prior to that, they generally run some blood work, make sure that all the values are okay for going under general anesthesia. Also, in some cases, if it's a clinic that has a dental x-ray machine, they will take dental x-rays and just make sure that all the bone and everything looks good there.
Yeah, because it's hard without dental x-rays. I mean, it can be done, and we do it without dental x-rays. With dental x-rays, it does help for us to see those diseased teeth, what the roots look like, if we need to, yeah, that's my Yorkie pulling away. Check the roots, see if they're actually, make sure they're not diseased. If they are diseased, which tooth, we're able to mark which teeth need to come out. We can also make sure do post-dental rads just to make sure we did get all the root out so there's not leftover root in there, because it is kind of hard without dental x-rays. Veterinarians can do it. They are, quite talented individuals, so they can still do that without dental x-rays. But
yeah,
your prime time would be dental x-rays. Blood work for sure, CBC or a complete blood count, chemistry panel. Chemistry panels run your kidney values, your liver values, your pancreatic values. It looks at your electrolytes, see if your electrolytes are off balance. Chemistry panels are very important. We can find underlying disease with chemistry panels. That's also something you probably should be doing on your annual visits with your veterinarian. Young pups, young cats, not necessarily, I mean, they don't push a whole lot for the young ones to have it done, but as they reach, 4 or 5 years old, would you say, Devin?
Yeah.
That annual blood work would be ideal, probably.
Yeah.
So
I'm cuckoo, and I do it on all my pets all the time.
Yes. As veterinary technicians, as veterinary assistants, as veterinary professionals, we have the ability to be able to run blood panels on our pets annually. Also because we see terrible, awful, horrible things in vet med, so we are a little overcautious with our own pets. So I too run blood work annually on all of my pets just to make sure that there's nothing popping up that's abnormal from what it was the year prior, and that way I can jump on it pretty quick. But again, it's because we are in vet med, we can do that kind of stuff. It's harder to do that when you're not in vet med. Because of course we do have perks being in vet med, just like I'm sure human nurses and human doctors have perks too, with being able to run blood panels and things like that.
Also they'll do a more in-depth oral exam before the dental cleaning. We were talking about things before the cleaning, right?
Oh, yes.
So a little bit more in-depth, at least once they're under, we make sure we see what teeth are missing, what teeth are there, and we chart all that. And then move on to that dental cleaning.
Yes. Making sure once they're, most pets are pretty good patients. I will say majority of our patients are pretty good. They are, and you can do a good oral exam. However, it is really hard to get to the back of the mouth. It's really hard to look at the lingual side or the side of the teeth that touch the tongue. It's also hard to look at the palatal side, which is the roof of the mouth, being able to look at the inside of those teeth. It's hard to do with a pet awake. It's much easier to do with that pet under general anesthesia. You can probe those teeth, see if there's any deep pockets. So yeah, we do a more thorough oral exam while they're under general anesthesia, just because it's easier on us, it's easier on the pet. We're not having to, wrestle your pet to try to look at teeth. It's just easier all around for everybody and every being involved. Let's see. Another thing to touch on is doing routine dental cleanings does help prevent tooth loss. So if we can keep those teeth clean, they don't become diseased as quick, I guess, and we don't have to pull as many teeth. That also being said, some dogs, like I said before, just have bad mouths. So just by breed, just by pH, bacterial population in the mouth, it just happens. So some pets still have to have their teeth pulled regardless. Some have to have teeth pulled annually. Keep in mind, dogs and cats have tons of teeth. Even if we tell you we pulled 7 teeth, That is a bare minimum of teeth in your dog's mouth, okay? What is it, Devin? Is it, here we go, we're gonna go back to our RVT
42,
days.
right?
42, I was gonna say it's 42, 43, something like that. Correct me if I'm wrong, you can post a comment if we're wrong. Teeth that your dog has. Of course, your cat has less, but your cat's mouth is a lot smaller than your dog's mouth, and they didn't need as many teeth. They just need those canines to macerate that meat, you know, when they were in the wild. However, they're domesticated now, so they don't have to do that. So it's small potatoes. When we tell you we pulled 7 teeth, don't be scared. Your dog can still eat. We will be fine. Most dogs don't chew their food anyways. They just swallow the kibbles whole.
Yeah, I was going to say, even if we pull all of their teeth, they're generally going to be okay.
Yes, yes. Not to mention,
they will still eat.
They will find a way to eat. They will not starve themselves, I promise. If they are healthy dogs and healthy cats, they will not starve themselves, I promise. They will eat when they are hungry. They will eat when they are hungry. So yes, they have a lot of teeth. So don't fret if we say we pull quite a bit of teeth. And we're not going to pull teeth just for fun. Only going to pull teeth if they need to come out, because it is a huge undertaking to pull teeth. There's a lot that goes into pulling teeth. It's not as easy as you would think it is. Of course, suturing gum tissue and all that too, to make sure that we don't get any food up in there, particles up in there, infections.
Especially if it's diseased gum tissue. I've watched our vets, try and suture that up and it's falling apart.
Yes.
It's very difficult, very tedious work.
Yes. When that gum tissue is diseased and inflamed, yes, it makes it very hard to suture that gum tissue. Your veterinarian will do the best that they can, the absolute best that they can, for the oral health of your pet. But some may go home on antibiotics. Definitely we'll send them home with pain medicine if we do pull teeth. If we don't pull teeth, we usually don't send them home with pain meds. Think of it as, when you go in and get your routine dental cleaning, your gums may be a little bit sore, but that's about the gist of it. They usually don't need pain management when they go home, if we haven't extracted any teeth with your dental cleaning. Let's see. This little thing does talk about root canals. Just so you know, there is a veterinary specialist in dentistry, and I do believe he's in Tulsa, Oklahoma. So she, I'm not really sure if it's a he or she, I have not been there. But there are specialists in veterinary medicine. So if you do want your dog to have a root canal or a crown, or they actually do dog braces too, believe it or not. If you want any of these things, your veterinarian can refer you to a specialist, and that is an option. So do keep that in mind. That is an option. You don't have to do that, but if you want to do that, that option is there. That option there. There's tons of veterinary specialists. So many. You'd be so surprised. Just like in human medicine. Huh?
I was going to say, if you're not happy with, what you're hearing from your veterinarian or whatever, don't ever be afraid to get a second opinion. There's so many wonderful vets out there that I would say get a second opinion if you're not happy with what you're hearing. Throwing that in there.
Absolutely.
But, yes, definitely specialists. They're all out there. There's so many specialists available.
There are so many. Second opinions are okay. We won't get mad. I promise. Pinky promise. Pinky promise. We will not get mad if you want a second opinion. You are entitled to a second opinion. That is your right as a pet owner, just like in human medicine. If you don't feel comfortable with something your veterinarian or your veterinary professionals have told you, that's okay. That's okay. You can go get a second opinion. We're okay with that. Don't ever feel bad about doing that. So, good point. Good point, Devin. You can't always get a second opinion. That opportunity is always there. Depending on the state of your pet's mouth before they do the dental cleaning, before we put your pet under general anesthesia, may or may not send you home with antibiotics prior to the dental cleaning, just to help knock down some of that bacterial population on the teeth and on the gums. Because when we scale those teeth with an ultrasonic scaler, just like they do for you when you go in for your dental cleaning, We can aerosolize some of that bacteria, which is a problem for us sometimes too, which is why you have to wear a mask and you have to wear safety goggles, your PPE. Anyway, we can aerosolize some of that bacteria, and if the gums are super inflamed and we have some bleeding, some of that bacteria can leach into the bloodstream, and that's where your antibiotics come into play. So we try to knock down some of that bacterial population in the mouth, on the teeth, on the gums prior to your dental cleaning to decrease the chances of us being able to aerosolize some of that bacteria. So may or may not put you on antibiotics, just depends on your pet's mouth and what we see on physical exam, whether or not we'll put them on antibiotics. But you may put them on antibiotics. Is it 3 or 4 days prior, Devin, that we typically do?
Yeah, I think, 2 to 3. Also, a lot of times, the canine tooth will abscess through up into the nasal canal. And so we sometimes have to send them with antibiotics for that as well and clear out the abscess before we can even go in and perform the dental procedure.
That's true. That's true. They can get what's called oronasal fistulas, which basically means there's a hole communicating between the gum line and the nose, the nasal canal. So it will be a hole that will communicate, so it will go all the way up. So they can get, infection up there too. So yes, antibiotics. Let's see. Oh, also if there's an abscess tooth, they will do antibiotics prior to the dental cleaning for an abscess tooth too. Again, just to decrease the amount of bacterial population that is in that mouth, Trying to think of what else. I can't really think of anything else. You said, did we cover all the all the dental disease stuff? I don't have a script, guys. This is not scripted.
I think we covered quite a bit. I guess the only thing would be, a lot of people are nervous about anesthesia.
Yeah.
With their pets, and definitely doing those preventative cleanings, getting those annual dental cleanings done, or when they're necessary to be done, would help keep that risk lower, because you're lowering the chance of getting systemic disease from a diseased mouth.
Yes.
But yes, your pets are always monitored 100% of the time that they are under anesthesia with us. They're always, we take care of them like they're our own babies. We swaddle them, hold them like little babies as they're waking up.
We do. After surgery, they're wrapped in blankies, and we hold them like it's a newborn baby. I am not kidding. I am not kidding. I can actually post pictures and prove that to you of all of us. I think all of us do it. Every single one of us at our veterinary practice. Swaddle your pet.
If they're too big for that, we lay on the floor with them.
That is true. If they are too big for us to swaddle, because, let's be honest, there are some huge dogs out there. We do lay on the floor and snuggle your pet. We do spoon your pet and snuggle with them. I promise. They are not waking up alone and scared. They have someone with them the whole time, loving and snuggling, so they are not alone. They're not alone.
Yeah.
Hey, that's a good point. Why don't you talk about the monitoring so that people know what we do? Because, they're not sure what we mean when we say we monitor pets. So what do we do when we monitor the pets?
When we monitor them with an EKG, that's hooked up, we monitor their heart rate, their oxygen levels, we monitor their blood pressure, how many breaths they're taking per minute. We also, will adjust the gas dosage of the anesthesia based off of those levels. Yeah. Is there anything I'm forgetting?
Oh,
We do give them IV fluids while they're
yes,
under.
I was gonna say that too. We do fluid therapy. Not only does it help keep them hydrated because they're coming in fasted, meaning no food or water past typically midnight, 12-hour fast, 10 to 12-hour fast, or 8 to 12-hour fast. We do run them on IV fluids, keep them hydrated, help filter out some of that anesthesia too.
Yeah.
By running them on fluids. They just feel better when they wake up hydrated after.
Yeah, I was gonna say, whenever I get fluids, oh my gosh, I feel like I can.
Yeah, you just feel better. You just feel so much better when you're hydrated. When you're not hydrated, you feel like dumb. So they do. Yeah. They wake up feeling better when they're hydrated.
Fluids are amazing, especially because we have so many pets come in for fluids. IV fluid therapy, and then by the end of the day, they just look so much better than when they first come in.
Totally back to being normal. We will touch on that when we figure out how to do our Facebook Lives and add her on there. Maybe we'll just meet up. We're just going to meet up on Sunday. We will talk about, all different topics. So if any of you have anything specific that you would like Devin and I to talk about, then post it in the comments so that way we can see it. And then that way we can answer all your questions. Anything you want to ask us about.
Yeah.
Anything you want to ask us about. You've been
in this field how long now?
Oh my goodness gracious. So I started in vet med in 1995. Took a 2-year break. No. 3-year, no. Let me see. 95, a 4-year break, I think it was, 3 or 4-year break. And then went back to school, got my RVT, and graduated in 2004. So I have been doing this a very, very long time. Very long time.
Selena's got the knowledge.
I would be called what you would call a seasoned technician. A seasoned technician. Not a baby technician, a seasoned technician. I've been here for a million years. So yeah.
I think I'm finally no longer a baby technician.
You think you're no longer? No, you are no longer a baby technician. You are not. I would say a baby technician, you'd still wet behind the ears. What would we say? Probably 3-4 years in, maybe less. There's so much to learn. I'm still learning stuff. Even now, you can never learn everything there is to learn in life or in vet med.
There's so much. Well, and you and I are going to go do a veterinary conference for our continuing education.
We are this coming week. Hey, maybe we could jump on a Facebook Live while we're there and just let everybody know what we're doing. We might do that, guys. We might do that.
Yeah.
You can kind of see.
There is so much to still learn. We're about to still learn a lot.
Yeah. Yes. We can let you see what a CE conference, a continuing education conference, is about, because we, as RVTs, we do have to have continuing education to keep our licensing up. We can talk about all that in a different episode. I did want, so this is where the selling part comes, because I do have a boutique. Okay, so I got to show you guys something fun.
Yeah.
I got to show you something fun.
Stuff.
Oh my gosh.
Show me the goods.
So, okay. How cute is that? How cute is that? Look at that.
Hold on, it's my phone is so laggy, I can't see. Yeah.
He's for Valentine's. He's a Valentine's Lufa, and he's squeaky. He's for Valentine's Day. See his cute little heart.
Chewy's favorite.
Chewy needs some. So these I have these in my boutique. $5.99. It's a dog treasure. Okay. Dog treasure. $5.99 for Valentine's Day. I will bring you one. They are so cute. I know, they are so cute. I wanted to show you these two. These are super fun. And when I do my events, when I go and do my events, my pop-up shops, I guess I should say, these are one of the biggest sellers that I have in my little pop-up events, are these puzzles. Oh, I got to figure out how to put it up there correctly so you can see it, because it's kind of backwards, and I'm slow on the digital stuff. Anyway, This is I believe this is a 3. Yeah, this is a level 3 dog puzzle. So these are super cool for any dog that has separation anxiety. They get bored. They're destructive dogs that just want something to do. You know, like herding breeds, working breeds, they get bored really easy. They want something to do. They want a job. These are super fun for them. So you put treats in there. You don't have to put treats. You can put dog kibble in there too. You know, you can make that part of their feeding routine. Put dog kibble in there too. And they have to work to try to find the dog kibble or the treats inside these little treat puzzles. They're super fun. These are one of my huge sellers. I have all different levels. I don't just have this one. I have multiple other ones, but I wanted to show you these. These are $24.99. You can also get them on my Facebook page. You can get the loofah dog on my Facebook page too. Just private message me and we'll get it situated. So you can get the dog puzzles on there too. Since we're almost running out of time, I don't forget about the cats. Okay. So who doesn't want a laser chaser for their cat? Do you know how many cats love to chase red dots up the wall, down the wall, on the floor, anywhere?
My cats love it.
Laser chase things. All different colors. These are $4.99 at my boutique. These are in my cat treasure chest. So I have a doggy treasure chest and a cat treasure chest where you can get fun things for your pets. This is one of the things in the cats. I have other stuff in my cats too. I have catnip stuff in there as well. So, but we'll have to touch on that probably another time because we're going to run out of time. I don't want to have to keep you beautiful people for the rest of the evening because that's just not fair. It's just not fair. Oh, I did bring one more thing in here too. My super cool ombre harnesses. Look how fun those are. It's upside down. Let's flip it this way. Look how cool those are. Look at those colors. They are so pretty. So these are mesh breathable comfort harnesses. They are choke-free harnesses, so you don't have to worry if your dog pulls, sliding up on the neck and choking on them. It's more like kind of like a scoop neck t-shirt. It pulls tight around the chest, not around the neck. All different colors. I have those posted on my website too, or not my website, I'm sorry, on the Facebook page too, under photos. They're a little different in how you close them. So you actually close them like this. The reason why you close them like that is so they're tighter around the chest and looser around the neck. They also have the buckles and these little straps cinch up so that they can pull tight. So that way they don't pull out of the harness. That's another thing I like about these. They will not pull out of these harnesses. They cannot slip their legs out of these harnesses. I love these harnesses. I love the colors. They are so breathable. They're mesh. They are machine washable. I mean, look at those colors. How cute are those colors? I mean, look at that.
Perfect for like summer.
They are so cute. And I have so many different colors. This is my dog, Gidget's harness. She is a 40-pounder. And it fits her perfect. This is a extra large and it fits her perfect. So anyway, I wanted to show you these harnesses too because I absolutely love them. These are not ones like you get at PetSmart, Petco, things like that. They do not have the doggy design harnesses, I don't believe there. I really like them. So you can go look at those too on my Facebook page. Well, I guess do we have anything else you want to say? Thanks for tuning in to our Facebook Live event. Hopefully we'll get better at this. We'll get better. We are going to have other people join us too. My good friend Lisa, she's wanting to come along and she's a freaking hoot. So we will have Lisa join us. Another RVT friend of ours, Mallory. When she gets some extra time, she's going to come on here and talk with us too. And we'll talk about all sorts of things. Talk about all sorts of things. We could even talk about, I don't know, Mallory's dating life, if y'all want. Whatever you want to talk about. Educational things. Yeah, educational things, personal things. Let's just talk about it. Let's just talk about it. I mean, we're all just people.
We're just texts and crazy world.
Yes, Technicians in a Crazy World. That needs to be the name of a book. Technicians in a Crazy World. That would be us.
I'll write that book.
Girl, you totally could write that book. I will help you write that book. All right, friends. Well, thank you for tuning into our Facebook Live, whether you did or you didn't. Hopefully you will watch this video, you know, later, maybe at some point. We appreciate you guys. Give me a follow, and we will see you guys next Sunday. Hopefully earlier next Sunday. We're going to try 3 o'clock. We'll see how things work out. So
and we'll figure this out.
We'll figure this out. If not, I guess Devin and I are going to meet up at 3 o'clock next Sunday and drink mimosas and things. Anyway, let us know what you want us to talk about in the comments, and we'll be back. We'll be back next week, guys. We appreciate you.